Okay, I think our next presenters our next presenter was Nonhlanhla, but unfortunately, due to an emergency, she's not able to present, but she will record her presentation and all our presentations will be shared on our SEET YouTube channel. So you can look out for that. I see Dr. Sonia and Dr. Jonathan Ziegler is ready for presentation.
Okay.
Thank you so much.
Thank you.
Good morning, colleagues, and once again, thank you to the CIEC team for giving us this opportunity, and it's a privilege to share our journey with you. Next slide, please. So just disclaimer, we've taken some photos and obviously we've asked permission from staff and students alike. Next slide, please. So what we're going to do is we're going to introduce ourselves and then following that, we'll turn off our camera. So I'm Dr. Bredenkamp and I reside in the Department of Conservative Dentistry, and I interact with dental students on the clinical platform, and those students are third years, fourth years, and fifth years, and I also interact on the preclinical platform in second year, fourth year, as well as fifth year. And in addition to that, I also coordinate this module together with my colleague, Dr. Ziegler. So I've been on this clinical platform and this preclinical platform for almost 18 years at the grassroots level with our dental students. I'm also a mother of two, and that in itself gives me insight to the generation of students that we're interacting with currently.
And I'm Jonathan Ziegler. I also reside in restorative dentistry, and I teach alongside Sonia in Cons 200 module. I also teach second years, third years, fourth years, and fifth year dental students. I previously taught ART 510, which is a fifth year module. It's a preclinical module. And I also work in private practice, and I'm bringing along all the preclinical and practical experience to the Cons 200 module, which is basically a junior fundamental based module.
Okay, at this stage, I'm going to turn off our camera. Okay, next slide, please. So the faculty had a curriculum review pre-COVID, and the planning of this program, especially the Cons 200 module, the planning phase of it took place over a very unprecedented time in our academic area. And because of this, we were sort of directed and guided, especially within our department, we were guided towards the blended learning approach, and that is where we're at currently. Next slide, please. So in the department itself, we obviously looked at our curriculum within the conservative dentist department, and here I just have to give you some context as to what we do in the department. So we teach the students preclinical procedures, so it's the filling and drilling of teeth. We do endodontics in our fourth year, and we also do crown and bridge in our fifth year. So what we did when we looked at our curriculum review, especially within our department, we realized, and we had to analyze the situation where we realized that we needed to increase the clinical time of our students, because we realized that our fourth year was jam-packed with modules. And hence the department then took a very bold move to move this techniques course to the second year level. And you can see the picture on the left-hand side. Our students are amazing. They were very enthusiastic and excited about this bold move taken by our department. And also, we then followed this process under the guidance of Dr. Lundi, our education advisor. Next slide, please. So hence the birth of a new module, Con 200. And this module, no pun intended, is still at its teething stages. And this module commenced in 2021 under the guidance of Dr. Lundi. Next slide, please. So when we looked at the program in terms, and this is a year module, Con 200, we needed to obviously follow the process of analyzing, designing, developing, implementation and evaluation of this program for the year. Because if we look at the module, it actually consists of a theoretical framework which we undertook in the first semester, and it also has a practical framework in the second semester. Next slide, please. So when we actually did this, when we were in the developing stage and the designing phase with Dr. Lundi, with this program, there were 3 key areas that we looked at. And it was looking at the flipped classroom approach versus the traditional classroom approach. Bloom's taxonomy, because we were dealing now with second year level students and not third year level students, where traditionally this preclinical course was given in the third year, and also focusing a lot on student-centered learning. Next slide, please. So where the transformation came in, so we needed to look at this flipped classroom approach. And we obviously needed, because we've been in academia for such a long time, and you always have wanting to go back to your old patterns, the traditional way of teaching, we obviously needed to really engage with what this concept was all about. And we also then needed to present this teaching practice and the strategy to our department. And even though you see smiling faces on the slide, we were quite apprehensive because we needed to take this bold move in our department. Next slide, please. So also looking at transformation, we needed to look at, and you obviously need to, in anything that you do, you need to look at Bloom's taxonomy. And at the level of our didactic framework or the theoretical framework, we needed to see where we needed to pitch our content with our second year level students, which is at the bottom of the pyramid, but the most important, because even though we have a pyramid, that is actually the foundation phase for the subsequent years, third, fourth, and fifth year. Next slide, please. So just looking at the theoretical framework of first semester, we then placed our interactive study guide. So we went full online. We placed our lectures on the eCanva learning management system. We also placed our assessments for the theoretical framework in the first semester. Next slide, please. We also introduced for the first time our learning and teaching activities on the eCanva learning management system, where we wanted to meet the objective of being where the students takes responsibility for their own learning, being student-centered. And so we had tasks also placed on eCanva. Next slide, please. We also introduced our cons interactive sessions, which you might, which is more like a tutorial. And we also used this was used in combination with eCanva learning management system. And here the objective was to be student-centered, but also to enhance student learning for our students. Next slide, please. So besides the cons interactive sessions, we also introduced clinical interactive sessions for the students. And this then gave, which is one of our learning and teaching activities, and this then gave the dental students the opportunity to give us feedback and also, more importantly, reflect on what they have done, which is a very fundamental component of any module. And not so recently, we actually had a very good presentation in our learning and teaching sessions, which is spearheaded by Dr. Lundi, by our colleagues, Natalie Gordon from the OH department, Dr. Bahardin from oral surgery, and Dr. Masal Kibido. Next slide, please. And then just to close off that theoretical framework, we then placed our assessments, and it was a combination of assessments, which was the individual online assessments, as well as group assessments. And like the previous speaker mentioned, we actually also used his example, a similar example, where we used our assignments tool to actually bring this approach across. Next slide, please.
So part of our development was also to improve the preclinical, or what we call the practical part of the module. And in 2022, this year, we actually flipped the preclinical module also onto the online platform. And we recorded quite a lot of all our demonstrations, practical demonstrations, we recorded, and we placed it on eCanva as well. Next slide, please. So what it actually does is, by placing all the preclinical demonstrations and videos on the online platform, it gives the student the understanding, or the opportunity now to learn at home as well, and to understand and to remember all the concepts of the practical task that lies ahead. And when the person or the student comes to the preclinical practical sessions, they're able actually to create and to improve and to apply the knowledge. Next slide, please. So we've now started with the didactic part on an online platform, and we also improved and recorded all our demonstrations of the preclinical practicals and placed that on Canva. We also added, together with that, we added all our preclinical notes that the student can use. Next slide, please. So all our videos, whether it's videos on instrumentation, on materials, on occlusion, is now being placed on the online platform. Next slide, please. So when the student comes to the practical lab, he or she has an opportunity now to refresh their memory and go over the preclinical notes before they actually start with all the preclinical or practical tasks. Next slide, please. So in the preclinical lab, which this is, the students has the opportunity to go to all the practicals, and this is done in a group form. Here you can see on the left, all the practicals is being or are being assessed by a clinical supervisor, and this is done on an informal formative basis. On the right-hand side, you can see the students are also conferring on one another on the task that lies ahead, and that also helps in reflecting on the tasks that they need to do. Next slide, please. What we do in the preclinical laboratory, we also assess the students by means of a rubric. All the practicals, all the tasks is assessed by a rubric on an informal formative basis. And the students also has the opportunity on an individual basis, as you can see on the right, to confer with the supervisors on the task where they can improve on a specific task. Next slide, please. This is just an example of the rubric that we use in the preclinical laboratory. So this is also done on a formative basis. Next slide, please. At the end of all the practicals, the student will write a practical examination as well as a written examination. And this is just examples of the tasks that they do as part of the examination. Next slide, please. Next slide. So, like I said, they also write a written examination, which happens after the practical examination at the end of the year. Next slide, please. So with regards to our reflective practice, we feel it fit to use Sean's model as a representation of reflection practice, where Sean says the concept of reflection is in action and reflection is on action. So the students now have an opportunity to look at their practicals, confer with a supervisor, and actually use that feedback to improve on their practicals. Next slide, please.
So what were the benefits and the challenges with the this new module CON 200 at the second year level using the flipped classroom approach? So going back to the initial presentation, it encouraged peer learning amongst our second year level students. We are still growing the student-centeredness learning of the students. Our clinical platform, especially with the clinical cons interactive sessions, was used as a classroom prior to the preclinical platform. And also another benefit was early introduction of the flipped classroom approach to the junior students early in the conservative academic program. Our challenges were bridging the gap with respect to our learning and teaching between the secondary and tertiary education. Bridging the gap also because we're placing those dental tools for the first time in the dental students as at the second year level. So this is where we will actually then get to see and they are able to then demonstrate their fine motor skills. And I think the biggest challenge was, and also for myself, was it took quite some time and patience with staff and students to really understand this type of teaching practice or this approach, especially with the practical aspect at the second year level, which was never done before. So that was our challenge. Next slide, please. And thank you for listening to our presentation. Thank you.